Hi everyone. So in this video we will be discussing about the most important cranial nerve, that is vagus nerve, 10th nerve. We will be discussing about its course and its branches. First of all, course. Vagus nerve exits the jugular foramen. Vagus nerve here is exiting the jugular foramen, and in jugular foramen we have the three nerves, that is 9, 10 and 11, glossopharyngeal, vagus and accessory nerve. So it is exiting along with the accessory nerve, while the glossopharyngeal nerve, that is the ninth nerve, is having a separate sheath around it. So it is separated from these two nerves. Okay, then it exits the foramen, and there are two ganglions in the foramen. There are two ganglions after emerging from the jugular foramen, superior ganglion and inferior ganglion. Superior ganglion. The superior ganglion is in relation to the that similar nerves, ninth nerve and 11th nerve. And along with the ninth and 11th, sympathetic trunk is related to it. And then inferior ganglion. Inferior ganglion is related to the hypoglossal nerve, that is 12th nerve. And then the cervical spinal nerves. Cervical spinal nerves, that is first and second cervical spinal nerves and superior cervical sympathetic ganglion and cervical sympathetic ganglion. Okay, superior is related to 9 and 11 nerve, inferior is related to 12th, C1, C2 and cervical sympathetic ganglion. Then it forms two ganglions. Then it comes to the neck region, descends vertically in the neck, in the carotid sheath. It will be first lying in the carotid sheath, and in the carotid sheath it will be first along with the internal jugular and the internal carotid artery, internal jugular vein and internal carotid artery. Okay, then after the internal carotid is means after the emergence of internal carotid, it will be common carotid. So it is going between the in common carotid and the vein to the root of the neck. To the root of the neck, it will be going through the common carotid and the internal jugular vein. Okay, then after that, the right vagus and the left vagus. This is up to the with the jugular vein, it is up to the upper border of the thyroid cartilage. Then after that it will be dividing into the right and the left vagus. Right vagus will descend posterior to the IGV to cross the first part of subclavian artery, while left vagus bit will be behind the left brachiocephalic vein. Okay. Right vagus will be posterior to internal jugular and left vagus will be posterior to the left brachiocephalic vein, and right vagus is crossing the first part of the subclavian artery. Right vagus is crossing the first part of the subclavian artery. So that is about its course, the rough course. Then we are the dealing with the branches of the vagus. Branches of the vagus. First three branches we will be remembering by the mnemonic map. Okay, first one, M for meningeal branch. Meningeal branch, as shown here, is arising from the superior cervical ganglion, superior vagal ganglion, and passes through the jugular foramen to be distributed to the dura mater in the posterior cranial fossa. Okay, it is supplying the dura mater of the posterior cranial fossa. Then is auricular branch. Then from A we have the auricular branch. Auricle means it will be going to the auricle, ear, and it is also rising from the superior vagal ganglion. Then from the superior vagal ganglion we have two branches, M and A. Okay, meningeal and auricular. Then from the inferior ganglion, we will be having the third branch, that is P, pharyngeal branch. Pharyngeal branch will be from the inferior ganglion, and pharyngeal branch joins the rami of sympathetic trunk and glossopharyngeal nerve to form the pharyngeal plexus. It will be forming the pharyngeal plexus, and pharyngeal plexus will be supplying all the muscles of pharynx and soft palate, except which muscles? Stylopharyngeus and tensor villi palatini. Stylopharyngeus and tensor villi palatini. Okay. Then After that, it will give branches to the carotid body. Then, then after these branches, we have two main nerves left, that is superior laryngeal and recurrent laryngeal. First is superior laryngeal. Superior laryngeal is further divided into internal branch and external branch. Internal branch is sensory and parasympathetic. Internal branch will be piercing the thyrohyoid membrane, the membrane between the thyroid and the hyoid bone, the thyrohyoid membrane. Okay, and it will give upper and lower branch. Upper branch will be sensory to the pharynx, epiglottis, vallecula, and laryngeal vestibule, while lower branch to the aryepiglottic folds and arytenoid cartilages. Then is external branch. External branch is shown here. External branch is supplying the cricothyroid and inferior constrictor muscle. Inferior constrictor and cricothyroid will be supplied by the external laryngeal branch, and it is also giving branch to the pharyngeal plexus. Okay. Then we have the recurrent laryngeal branch. First of all, regarding the recurrent laryngeal branch, we need to know the around what structure it is curving. The right recurrent laryngeal nerve will be rising anterior to the first part of the subclavian artery. Okay, right recurrent laryngeal in relation to the anterior part of the first part of the subclavian artery, while the left one will be rising from the vagus on the left of the aortic arch in relation to the aorta. Okay, on left side we have aorta, so it will be rising in relation to the aorta and curves below immediately behind attachment of ligamentum arteriosum. And what is the function of the recurrent laryngeal nerve? It is motor to the muscles of the larynx. All the muscles of the larynx will be supplied by recurrent laryngeal nerve except which one? Cricothyroid. Cricothyroid was supplied by superior laryngeal nerve. Okay. And it communicates. And superior laryngeal nerve was sensory above the vocal cords. Below the vocal cords, the sensation is by the recurrent laryngeal nerve. Okay. Then after that, after the larynx, it will be dividing into anterior vagal trunk and posterior vagal trunk. Anterior vagal trunk will give branches to the anterior stomach and liver, and the posterior vagal trunk will give branches to the posterior stomach and liver, and also to the kidney. On the posterior, which structures we have? Kidney, small intestine, and colon, up to the right two-third of the transverse colon. So that were the branches of the vagus nerve. Important branches. Okay. So the first we will be going through again. First we have map, meningeal auricular from the superior, pharyngeal branch from the inferior ganglion. Then we have superior laryngeal nerve. Then we have recurrent laryngeal nerve, anterior vagal trunk and posterior vagal trunk. So that's all about the vagus nerve. If you liked my content, please do subscribe my channel. Thank you.